Hey, welcome back to Two Stupid Guys Trade Stocks. I'm Dylan.
And I'm Vinny, and today we're going to talk about something interesting. For those of you who've been around the channel for a while, you may or may not know that both Dylan and I work in medicine. And this is kind of an interesting topic that came up, in the news recently. It's something I've been following for a while, and I'm interested to kind of talk about it with Dylan and see, what his take on this whole story is.
Yeah. If you like this kind of entertaining stock market content and other random things, go ahead and give us a like and subscribe. Okay. Two Stupid Guys Trade Stocks.
All
I
right.
just realized one of the cavemen only has one tooth.
That's kind of interesting. Maybe
I
we should get like better dental coverage. I don't know.
I've seen it probably 500 times. I just realized that.
Yeah, I never noticed. So this story is about this lady right here on the right. Her name is Radonda Vaught. She's a nurse at Vanderbilt University Medical Center in Tennessee. This is actually her lawyer next to her.
Okay.
Why does she need a lawyer, right?
Yeah, I
So
also don't know this story. I don't know what's happening.
yeah, it all comes back from 2017. So she's a neuro ICU nurse, and one night she's kind of working as like a float within the unit, help her nurse, help out everyone else, and she's tasked with taking this lady right here, Charlene Murphy, down for a PET scan. Charlene Murphy apparently had a little bit of claustrophobia. Doctor ordered a sedative before she went down for this. Ordered a little bit of Versed. All right. So the nurse, in the midst of doing this, all her task, she's also actually training that day. She has a trainee with her. So she goes to the Pyxis to obtain, this is a PET scanner, kind of what it looks like. Kind of makes
Did you
sense that
say
there'd
she
be a
was
little bit of claustrophobia.
training or had a
She was training
trainee?
someone else. She had a
Got it.
trainee with her, right?
Got it.
So in the midst of like explaining things to them and that sort of stuff, she's also obtaining this medication. For those of you who don't know, this is a Pyxis. This is where you would go to get medication, right? So she's trying to get this Versed, generic name midazolam, out of the system. She pulls up the patient, and there's supposed to be a cross compatibility with both the Pyxis, or whatever medication dispensing item they're using, and the EMR, electronic medical record, which they had just gone to Epic. And she tries to pull it up, and it doesn't show any Versed or midazolam available for this patient. She's like, oh, whatever. She goes back to Epic, checks, makes sure that there is indeed an order for it. She sees it there. For some reason, it's not showing up with the Pixel. So she's like, all right, I guess I got to do an override, and I'll show my trainee how to do an override. So she goes back to the system, that is able to get into like an override function where it allows it to dispense, medications that are not listed to that individual patient. She puts in VE, hits the first one that comes up, and she takes it out, doesn't actually look at the label to verify what it is, looks at the back, and it says that it needs to be reconstituted, goes ahead and reconstitutes the medication, meaning you have to put actual like saline into it to make it back into like a liquid form. It's a dry powder. Administers 1 milligram of that to the patient down in radiology, and she leaves.
How long was she a nurse? Do we
Several
know?
years. I want to say 4 or 5. She wasn't new. She was seasoned enough that she was being training other people.
Because midazolam is not a powder.
Very good. Yeah. Yeah. But you know what is powder and also has VE?
I don't. I've never used that other medication.
Vecuronium. Yeah. Do you
Mm-mm.
know what it is?
I think it's used for anesthesia.
It is. Indeed. This is a paralytic. It's like a non-depolarizing paralytic, basically. So this is a medication that would have no effect upon your central nervous system. You would still be fully aware and cognitive, have that cognitive ability of what's going on, but you'd be unable to move. You would not be able to move any muscles in your body.
Okay. Do you still feel
Yeah,
everything?
you would still be feel everything. It has no anesthetic property as far as like pain, analgesia or amnesia, none of that sort of stuff. It's just a paralytic.
I'm
Just
pretty sure Gerard Butler used this in that movie where he tortures someone but wants them to feel it. I don't remember what the movie is. Someone commented.
oh, I don't know. I
Law-abiding
haven't seen
citizen.
that.
Ah, got it.
Okay, vecuronium, interesting. All right, I think I have seen that movie, but I do not remember any medications in it. So, as you can imagine, giving a paralytic medication to someone that is not on a ventilator is probably a bad idea, right?
Yeah.
Yeah. So the patient unfortunately was found to be unresponsive and in cardiac arrest. They were able to successfully revive the patient in terms of obtaining like a heart rate. But on further nuclear perfusion studies, they determined that the patient was brain dead. She had suffered an anoxic brain injury during her time of not having a heart rate and not breathing. Unfortunately, the story gets kind of crazy a little bit thereafter. So she's terminated by Vanderbilt. However, she's not reported to the nursing board. And this is not reported by Vanderbilt to the Center for Medicaid or either. It's not reported to the authorities in the state of Tennessee either. So none of the proper protocols were basically followed thereafter. About a
So were they
year
trying to
after,
sweep it under the rug or something?
it sure sounds not great. Well, I'll leave it at
No.
that. About a year later, a anonymous tip is given that says that this had occurred. At that point, an investigation is launched by the nursing board into her. She is subsequently convicted by them and like stripped of her nursing license. Vanderbilt is fined by the Center for Medicaid and uh, you know Medicare and Medicaid, and she is subsequently interrogated by the TBI. It's like Tennessee Bureau of Investigation, their state police basically, and she is arrested and criminally charged with 2 counts, with reckless homicide or negligent homicide, and initially, and then became reckless, and then also I forget the other one's called. It's like elderly abuse, basically charge. She's been convicted as of this week. She has not yet been sentenced.
Okay. It was convicted. Okay.
She was convicted. The interesting thing to me here is like, so this is a study from 2017, but basically they just, watched a few hospitals in Pennsylvania and they were able to extrapolate that out. And their estimate based on this is that about 250,000 people are killed by medical errors in the United States every year. And that we have a much higher rate of medical error mortality in the United States. So my main point for making this video is like, I just wanted to have a discussion regarding whether or not you feel that this is appropriate, that we are now prosecuting something that was by all accounts an accident. There were multiple compounding system errors and oversight, and yes, she certainly was has responsibility for this, but at what point does she rise to the level of reckless?
Okay. I'm gonna give you an analogy. I think I'm gonna
Yeah.
disagree. I do think this is directly her fault. Because what's this? It's called Pixis. I can't say
Pictus.
that word.
Hers, I don't think was actually a Pixis, but it was another medication dispensing
Right. It's a
device. Pixis
dispensary
is a
where you
brand
type
name.
it in so they can monitor everything that's being taken out.
Yeah,
Um, I mean, one, if you're a seasoned nurse, you should know. I mean, you would have used that medication at least kind of a lot, especially if you're in the ICU. You know that it's a liquid. It's not a powder.
yeah, midazolam.
Doesn't
See, I automatically abbreviated it there, which is how we get in trouble by doing abbreviations and
that
brand
is
names.
yeah, that is a problem. Um, you if you try to blame it on the system for having the error for the medication, that's like trying to blame gun manufacturers for killing people, right?
Which they're doing.
Which, yeah, this is going to be a great. This is my opinion. What was the gun manufacturer that just got charged?
Bushmaster. Oh,
There we go.
Remington Bushmaster. That
Remington.
was the actual brand name. Connecticut, the whole Newtown shooting.
I just, one, it's a liquid. Two, you only typed in the first 2 letters. And three, you didn't check the bottle. You always check the bottle. It doesn't make any,
Yeah.
you never just be like, these are really harmful medications. If dosed in any way incorrectly, especially in a woman who has, I'm assuming, a lot of chronic conditions, they're doing a PET scan. So,
She had a brain bleed. That's actually what she was admitted to the neuro ICU for.
oh, okay. I mean, I think there are certain. I don't like that the hospital didn't take the proper channels too, because that looks like they're trying to sweep it under the rug, and that's a more glaring issue.
Mm.
And well, not a more glaring, another glaring issue.
What's interesting too is so she discovered that she made this medication error, and she was one that came forward and like basically said, "Hey, like this happened. Like I did this." She fully was open and public about it. Even to the day of her sentencing, she was like in the hallway, apparently making statements to reporters saying like, "I'm glad I told the truth, regardless of the outcome. I'm glad I told the truth."
I mean, that is good, but it's like you still made a mistake that killed somebody. So it's,
Yeah.
you know,
It's interesting though. Like, so we have this kind of culture within medicine where I don't know how many times you've been to like a quality analysis sort of thing, but the idea being that you can come forward with your mistakes and that as long as like there are lessons to be learned from it, there should be a degree of what's the word? I want to say forgiveness, but like it's not designed to be a criminal prosecution. They want people to come forward with mistakes and not try to bury and hide things. You
yeah,
know,
no,
like
it's supposed to be a learning opportunity, and then if something like this happens, you do like a quick seminar. And like a lot of some hospitals like will review cases like that with residents as a way to learn. Like, hey, this
yeah,
just happened. Don't ever let
yep,
this happen
yeah,
again.
exactly. Like mine does that regularly, actually,
Yeah,
once a
you're in a
month,
hospital.
basically.
I'm in private practice. You have much more
Yeah,
experience with it.
so I think you're setting a bad precedent if you take someone that came forward with an error and are now like just hanging them out to dry as far as like it seems like from my standpoint. What has Vanderbilt done to address this? And there's a lot of inbuilt things there that I think are real barriers to good care. Uh, like what was the reason why this medication didn't come up? Like Epic is a walled off garden, right? That's how these EMRs are designed to be, right? They want you to only be able to use like their own system. They're not designed to share information freely and easily.
Yeah, that's a whole different issue. But I will say, I think there's a big difference in like, let's say you're in a surgery and there's a certain acceptable amount of risk and the surgery doesn't go your way. That's a little bit different because there was a talk about an accepted amount of risk. Whereas this is a, it's just blatant recklessness, to be honest. Like you, oh, that was, I feel bad. That was the charge. um, it was blatant, not paying attention, irresponsible.
Yeah, carelessness. I definitely get that. I don't know. I have mixed emotions about this, especially like in this day and age where they're struggling to get nurses. Like this is something that would really turn people off from a nursing career too, because you're seeing the same thing with law enforcement where there's this constant after action micromanagement, and unfortunately you don't have the opportunity to always do things like the way that makes sense when you've had 2 years to think about it. In like the moment that there's a lot of other pressures that are hard to sometimes weigh the risks and benefits of.
Yeah, I don't think that this was a high pressure situation, but I'm gonna say I mean, there's a vast amount of anomalies and scenarios that happen in healthcare and all this stuff, to where the majority of the time, I'm gonna go with you shouldn't convict the person. You know, it's always rough if someone passes from it and it's a blatant mistake. But there's a million things that happen, especially surgery wise, where there's an acceptable amount of risk. There was no acceptable amount of risk. It was just read.
Yeah, yeah, I agree. It's like it was sloppy for sure. It'd be interesting to see what sort of sentence ultimately the judge ferrets out as reasonable for this, because there's no doubt that she has a level of responsibility and has to pay for what she did to a degree. But it's crazy to think that like this woman could potentially be looking at years in prison for this.
Yeah, no, I mean that's definitely not great. But like one thing I will say, like when you prescribe medication, your EMR system will tell you if there's any conflicting things, right?
Well, that's part of the argument too, is that you get alarm fatigue, right? Because like you put in like, oh, like Tylenol is contraindicated in this patient. Like really.
Right. But I mean, what I'm saying is, I still, and we've been practicing for the same amount of time, but I still use Hippocrates just because two checks are better than one, and it takes me less than 30 seconds.
Yeah.
So, I mean, I think sometimes maybe not so much provider wise, but I don't, maybe nursing wise, the severity of the medications aren't realized of the stuff you're actually using.
Oh yeah, I mean, right? People do potassium infusions all the time, and they don't realize that, like, if I don't put this
Exactly.
thing on a pump and I just like blow it in, like that could kill them.
Yeah, and we
That's
know
fun.
that's the like people just think potassium, it's fine, whatever. But if
Yeah,
you're higher up on the hierarchy, you're like, okay, hold on, hyperkalemia can kill somebody. Let's think about this. So I don't know. It's really tough.
yeah. I don't know. I don't think there's a good answer here. I was just kind
There's
of
not.
curious, like, I don't know. I see, if this continues to be a pattern, I think you're going to seriously add to the burnout in medicine, and you're going to see fewer and fewer people pursuing medicine as a career because it already has a lot of issues.
It has a ton of issues. Yeah, a ton of burnout issues. That's a whole different thing.
Yeah, yeah. Well, I think things like this sometimes, unfortunately, compound that. You're adding more burden to the individual that is already tasked with a lot of different things. The system should be built to make their life as easy as possible, and so that they can focus on what they should be doing, rather
Yeah,
than like having to deal
completely
with
agree.
computer systems that are fighting them at every step and turn.
Yeah, I mean that's a different aspect. That's rough. That's not great.
Yeah.
I'm in a secluded area, trying to think of like specifics, um, where like everything is cohesive. So it's super easy. I don't have it.
Nice.
We don't have any of these issues because
Yeah.
it's all
Ah,
one thing.
that's awesome. Yeah, I mean, it's not something I personally struggle with a lot either. I use Epic on a regular basis. It's actually probably my favorite EMR. I hate Cerner with a passion. That thing is a complete and utter disaster.
Yeah, I
But
agree. Most people, Epic's like East Coast. A lot of people over here use Cerner.
great.
I hated it when I was using it. I
Yeah,
was like, this is trash.
I gotta love it. All right. Well, I just wanted to kind of get the discussion going a little bit. Be interested. We'll try to comment back and answer any comments or questions in the comment section about this stuff. It was
Yeah, and
interesting.
if this is entertaining, let us know. We're just kind of going with it. So, all right,
Yeah,
guys.
we can dive in deeper if you want. All right.
Have a
See you
good
guys the
one.
next one. See ya.